At this time, we'll recognize Brian Gottschall, our director of the Berks County Department of Emergency Services and the lead for the Berks County COVID-19 leadership team, for the Berks County COVID-19 data report, as well as the Co-County Wellness Update. Brian Gottschall.
Good morning, Commissioners. Thank you very much. Yes, our last report of the year brings some marginally better news than what we've seen in some prior weeks. Our cases for this particular surge appear to have peaked over. I do want to caution folks that there's a lot of lack of clarity as to whether we're talking about those having been a Delta surge or the beginnings of Omicron, and I would not anticipate that in ensuing weeks we're not going to see that peak be restored with even higher numbers as we start to see more Omicron in the community. Nationwide, things look very much similar to the way they have over the past couple weeks, which is generally pretty bad from a case transmission standpoint. A lot of COVID out in the community, small numbers of counties going up and down, but generally high transmissibility across the entire nation on a county by county perspective. Back to Berks County, our pediatric cases in the last week have continued to climb in the 5 to 18 range. But as I mentioned last week, this climb is not significantly out of proportion with our general situation in the community with the elevation of cases as compared to a few weeks ago. Very much good news front is our 0 to 4 cases are flat from this week to last week. Numbers in our hospitals continue to look rough. Again, worse this week than they were last week, but we're talking about relatively minor changes week to week, so I don't think it's representative of anything drastically different. But the message does remain the same, that our hospitals and our healthcare systems in general are under quite a bit of strain, and we would hope that everyone in the public recognizes the importance of that critical infrastructure and would step up to do their part to ensure that our hospitals and EMS systems are preserved for those who need it the most. So a little bit of good news on our influenza chart. We do see a little bit of a shallowing out of the climb of the slope of the curve in the last week. That's, again, the red line with the red circles on it. The red circles indicating the data points from week to week. And we see that that line is not nearly as steep this week as it was in the prior couple weeks. Again, we can't predict the future. We don't know whether that's indicative of the fact that that line is going to begin to curl over and represent that our influenza season this year is not going to be as bad as it was initially shaping up to be, or if that's just a 1 week data anomaly and we'll still see that climb. Again, the strong emphasis here is that the public has absolute control over this. People can choose to act in a responsible manner with respect to protecting themselves and their loved ones from diseases like influenza and COVID, and help to make that line not get in the ugly area that we're hoping that it doesn't get into. Going through a couple current events on the horizon, there is some fair news this week as far as COVID and COVID-related items. With respect to Omicron, which is, of course, the thing that everybody's looking at, there's reason to have some cautious optimism. In South Africa, the cases appear to have peaked out very high, but very fast, kind of a tall and skinny curve. Initial indications are that the disease does have lower virulence than, for example, Delta or even back to Beta. That although the disease appears to be very transmissible and spread through the population very quickly, folks generally are not getting as sick from it. In fact, there is a preprint article that is referenced in the footnote of the slide that shows a comparison between Delta hospitalizations and Omicron hospitalizations, and indicates that there is a lower prevalence of hospitalizations among those that are infected with Omicron than Delta. All of this information is very early, very new, and limited scientific articles coming out about this right now because it is so new. I do want to temper that caution and point out, or I'm sorry, temper that good news and say that there's some good reason for caution and some anomalies, or I guess more correctly, differences between South Africa and here that we have to think about. Because illness appears to be reduced, the virulence of the illness, it's possible that there are many more people infected that don't even realize they're infected, and who all represent the ability to spread that disease to others who may be more impacted by it. There's also significantly limited testing capabilities in South Africa. I mean, we're talking about that here in America, and our testing capability is vastly greater than a country like South Africa. So again, people may have the disease but not be getting tested or not have the access to testing. Also, it is summer in South Africa. We've clearly seen a seasonal component to this virus, and how the virus is going to act here in America in the winter months may be different than in South Africa. And finally, another article that came out of the Imperial College of London that compares Delta to Omicron hospitalizations. So the prior article I mentioned speaks to whether you're likely to be hospitalized. This article speaks to once you are hospitalized. And the bad news is that once you get into the hospital, it doesn't appear that the outcomes for Omicron are much better or different than the outcomes for Delta. So good news, less likely to be hospitalized, it appears. Bad news, once you do have a level of illness that necessitates hospitalization, it's unlikely that there's any significant difference. Also, very quickly, oral antivirals. We've talked for a couple weeks now about Merck, and that Merck approval still has not gone through FDA. But in the interim, the Pfizer oral antiviral has been approved for use in patients 12 and up who are of high risk. Likely going to be January until there's broad availability of this in all the communities across the country, and supply also will still be limited. Just had a discussion the other day on Monday with a number of our medical professionals in the county, and one of the things that were mentioned by our infectious disease expert is that they're very concerned that they're going to kind of have to make value judgments about who's going to get this, because there's not going to be enough for everybody. It's going to have to be reserved for those who are at highest risk. Want to also mention what's been in the news recently with respect to federal support of mobilization for communities throughout the country. Very unclear what that's going to look like. Great news that the federal government is stepping up and bringing FEMA and Department of Defense resources to bear to support impacted communities. But at this juncture, very unclear what that's going to look like, whether we're going to see additional testing supplies brought in, whether there's going to be support for our healthcare systems. And finally, just a very quick mention about an anticipated CDC review of quarantine guidance. Of course, I think we're all reasonably familiar with what the guidance is today if we're positive for COVID or exposed to somebody who has COVID and unvaccinated. I don't know where this is going to end up, but I think that people are looking at the R0 of Omicron, the preponderance of spread that we're likely to see in the community, and that coupled with a reduced illness and a shortened illness is causing people to look at this and say, how are we going to keep our society operating if everyone who is in this condition is isolating and not going to work and not doing the things that they normally do in society? And I would imagine that the federal authorities are trying to balance the need to keep our society moving forward, keep things going against protecting from the disease. I think it's likely that we're going to see a change downward in those number of days of quarantine related to this, but that's still a textbook yet to be written. Last thing is, I want to remind the public about our public testing opportunity that we have outside of the DES offices at 2561 Burnville Road. As mentioned previously, that opportunity is now closed through the Christmas holiday to allow the workers to have time to go home with their families, but it will continue again Monday through Wednesday of next week between Christmas and New Year's, 10 a.m. to 7 p.m., and has now also been extended again for the week after New Year's, Wednesday through Friday, Wednesday through Friday from 10 a.m. to 7 p.m. and the following Saturday, the 8th, from 9 a.m. until 3 p.m. Again, no cost, no symptoms. This is a drive-up test site. We would ask that people enter off of Van Reed Road and be certain not to queue out onto the public road. As testing needs have increased, we have had a couple problems there where the testing queue has extended out onto the public roadway, which is a safety consideration for everybody. We would ask if you get there and the queue is out to the public road, just drive by, go around the block, come back in 10 minutes, and it's likely that the queue will be diminished. We are seeing people get moved through very quickly in this. On our Cook County Wellness Report, again, we have to look at these columns in proportion, and what we see is that even though the numbers in the column are incredibly higher than they have been over prior weeks, meaning that Cook County is getting a lot more positive cases sent to them by DOH, the proportions of the colors remain the same. And what that means is that we're still seeing the public not being very cooperative in percentages with working with Cook County. Just 100 out of those over 3,000 case investigations resulted in the outcomes that we would like to see it result in, which is that individual having a conversation with Cook County, returning their case investigation questionnaire so that their contacts can be notified. Of those over 3,000, only a little over 600 even were willing to have contact with Cook County Wellness, and almost 2,500 that, despite Cook County's efforts to contact them, did not return the call or did not engage in a conversation with Cook County. That, of course, results in these contact investigations as an outcome of those initial case investigations. And again, we see the numbers for this week much larger as cases have gone up, but the proportion is very much the same as far as success and lack of success in Coe County's efforts. As always, refer everybody to doyourpartberks.com, where they can find a lot of good information about COVID and COVID-related matters. And our external affairs person, Steph Weaver, does a yeoman task in keeping that updated. I'd like to take 5 seconds, Commissioner, to say Merry Christmas to everybody and remind the public that there are a lot of people in our community, healthcare, emergency services, the military, who don't get to be with their families. So I hope that, particularly in this time of pandemic, we keep those folks in mind. Thanks, Commissioner.
Thank you very much, Brian, and very well said. We don't want to forget those people that work to keep us safe, whether it's health, law enforcement, military, and aren't able to spend these holidays with family and friends, but rather doing their job to protect us. Any comments or questions for Brian Gottschall? Hearing none, we will move on with the agenda.